Listen, I'm Dr. Mitchell, and what I'm about to tell you could save your life. I watched two-thirds of the so-called cancer experts on YouTube say things that are flat-out dangerous, and I knew I had to set the record straight. Here's the truth. 95% of cancers are curable, but only if you catch them early. That's why I'm going to walk you through the real warning signs, the ones that matter, and explain exactly why they happen. Not just, this symptom means that, but the actual mechanism behind it. You're smart enough to understand this, so let me give it to you straight. And before you think you can just go get some tumor markers tested and call it a day, let me stop you right there. Tumor markers are non-specific. There are hundreds of them, and the same marker can be elevated in 5, 6, 7 different conditions. A 25-year-old guy with prostatitis can have a high PSA and think he's dying when it's just simple inflammation. We order tumor markers to supplement a clinical picture when we already have strong suspicion of a specific cancer. We don't fish blindly. First warning sign: unexplained weight loss. Not the weight you lose on a diet or during a divorce when you're too stressed to eat. I'm talking about losing 6 or 7 pounds every month when nothing in your life has changed. You've lived the same way for 20 or 30 years, and suddenly the weight is falling off. That's alarming. Why? Because your body is spending its resources somewhere. There's internal poisoning happening. Could be hyperthyroidism, your thyroid pumping out massive amounts of hormones, revving your metabolism into overdrive. Could be other diseases, but unexplained weight loss is always a sign of illness, and you need to get checked. Now, I don't want anyone spiraling into panic from this video. No single symptom means anything on its own. But when you start seeing 2, 3, 4 of these signs together, that's when you move. Hit the like button and keep listening, because this next one's crucial. Fatigue and constant sleepiness. Obviously, I get tired too. I did surgery this morning. I'm filming now, and I have another surgery after this. That doesn't mean I have cancer. But if your lifestyle hasn't changed, and suddenly you can't handle the workload you used to breeze through, if you're constantly wanting to sleep, that's worth noting. Could be a gut issue. Could be hypothyroidism, where you're falling asleep at the wheel on your way to work. But why does cancer cause this? Because your internal resources are being spent fighting the disease. Every single day, your body produces abnormal cancerous cells. It's completely normal. You, me, everyone sitting here right now, but our immune system destroys them. In some people, unfortunately, due to genetics or constant exposure to harmful substances, the immune system can't keep up. The tumor starts growing beyond control, but the body still fights, pouring all its resources into the battle. That internal poisoning leads to drops in iron, then hemoglobin, then red blood cells. You develop anemia through what we call paraneoplastic processes. Your iron tanks. You become exhausted. You feel weak because you're being poisoned. So again, don't assume it's definitely cancer. But combine it with unexplained weight loss. The chances just increased. Night sweats and localized hyperthermia. Situations where a specific area feels hot or looks red. Immune cells are rushing to that spot. This can happen in early stages of certain diseases, especially when lymph nodes are involved. Sometimes you can feel these growths. Sometimes you can't feel a lump yet, but you sense something is happening. Let me tell you a story that still haunts me. I used to work at the Institute of Urology with this young guy, maybe 5 years older than me. Hadn't seen him in 10 years. One morning, I come to work, and there he is. I say, "What are you doing here?" He shows me his arm. There's a mass the size of my fist, starting from the elbow. Sarcoma. A malignant tumor. It's about 2 inches across. I ask, "How long have you had this?" He says, 3 or 4 months, but I kept putting it off. Thought it was a bump, a bruise, a hematoma. Thought it would go away. 6 months later, he's dead. If that guy had come in on time, they would have cut it out. given him localized radiation, maybe some chemo. But he waited. Metastases developed, offshoots where cells travel through the bloodstream or lymphatic system and establish outposts throughout the body. That's hard to cure. But if you come in on time, if you see that lump, we can just remove it. Same thing with moles. You've had one your whole life, maybe half an inch across. Then you scratch it, or get sunburned on vacation, and suddenly it's growing or changing color. Show someone. Don't delay. Don't think you're too busy. You have a report due at work. You have this or that. Disease has a way of grabbing you by the scruff of the neck and throwing you onto a hospital bed, and suddenly, you won't care whether you have time or not. All your plans, all your excuses, that's all fine until it's not. Cancer is terrible, but it's treatable. You just have to come in. You have to catch it early. Abdominal swelling. This seems innocent. We think we've just gained weight. But the abdomen can grow shockingly fast, especially in women. When ovaries are affected by a tumor, they can produce fluid, and the abdomen fills with liquid, ascites. The belly grows dramatically. I remember one of my first weeks in oncology. They asked me to examine a young woman, about 25. I didn't even suspect cancer back then, being so inexperienced. A month later, I saw her again, and her abdomen was huge, like she was pregnant. The key feature of ascites is that your belly protrudes, but subcutaneous fat stays the same. You're rapidly increasing in size because the belly is swelling from the inside. Don't confuse this with abdominal obesity. Usually when this happens, people don't gain weight elsewhere. They might even lose weight. Arms and legs get thinner or stay the same. But the belly grows. Lymph nodes. We're all terrified of swollen lymph nodes. But actually there are defensive outposts. They trap metastases, stop them from spreading everywhere. Sometimes that doesn't work. Some tumor cells camouflage themselves, disguise themselves as normal cells, fight our immune system, and start growing locally. Sometimes we can see lymph nodes enlarging in the neck, the groin. Two main principles you need to know. First, lymph nodes get affected along the flow of lymph. Tumor near your knee? You won't get a swollen node near your heel. Second, the key characteristic. Cancerous lymph nodes usually don't hurt. If you feel a lymph node and it hurts, if it appeared suddenly, that's most likely inflammatory. An infection. You have a toothache and nodes pop up on your neck. You cut your finger and nodes appear under your knee. Those will likely go away once the infection clears. But if you find lymph nodes that are immobile, stuck to surrounding tissue, hard, firm, painless, that's reason to see a doctor. The most common spots we check are the neck, above the collarbone, under the arms, in the groin. Underarm nodes can indicate breast cancer. Nodes above the collarbone can appear with stomach cancer. Groin nodes can show up with growths in the genital area. When I do a bladder removal along with the prostate, I also take out nearby lymph nodes to confirm whether there's involvement and to follow up with radiation or chemotherapy to wipe out remaining cancer cells. Why is lymphatic stagnation bad? Because your immune system doesn't work well. People with lymphedema, people who are overweight and don't watch their diet, who have poor circulation, those puffy, swollen legs aren't just unattractive, they're a health issue. It affects your anti-tumor and anti-infection immunity. So stay active. Avoid stagnation. Drink enough water. Have good lipid profiles and blood rheology. Poor circulation, systemic hypoxia, when you're sedentary, when you smoke. These are factors in developing disease. And by the way, cancer can strike even the healthiest person on earth. If you don't drink or smoke, that's no guarantee. People who get struck by lightning don't care how rare it is. It happened to them. The best treatment is prevention. Share in the comments what methods you practice. Some people stand on nails. Some jump in ice baths. Some eat tons of garlic. What have you actually tried? What works and what doesn't? Write in the comments. Support each other with likes. I'm waiting. If you've never suffered from migraines, and suddenly you're getting headaches constantly, worn out by them, taking painkillers all the time, that's the biggest mistake. Don't just keep taking painkillers. Get an MRI. There might be some lesion in your head causing these symptoms. Maybe it's nothing. Maybe it's vascular. But regular headaches when you've never had migraines before? Get an MRI. Also, watch for sudden hearing loss. We all expect to get a little hard of hearing with age. But if suddenly your right ear is getting worse, you're progressively losing hearing in one ear, or your vision suddenly drops significantly in one eye, or worse, one of your eyes starts turning inward, that's very serious. A lesion in the brain can compress centers that control hearing, vision, or eye movement. Get an MRI and see a specialist immediately. For women, I mentioned abdominal swelling and ovarian cancer. You can't detect ovarian cancer easily in early stages. But men, we have testicles. And we have hands. That's the best tool for checking. If women could feel their ovaries, they'd never miss anything. When you're in the shower, always check your testicles. Look for lumps, changes in shape, any irregularity. Don't immediately panic if you find something. It could be a cyst. But get an ultrasound. Check your testicles. Don't be embarrassed. Examine your skin, especially after sunburns. For the guys, check your chest tissue, especially if you have gynecomastia. If you've had breast tissue for 5 years and suddenly it starts hardening, that's cause for concern, because breast cancer in men is just as aggressive as in women. Check all your lymph nodes. You'll reduce your chances significantly that if something does develop, it won't turn into something serious. Body temperature. Fever isn't necessarily bad. It means your body is fighting. But chronic elevation, 99 to 100 degrees Fahrenheit, sometimes even 102, can be a sign. I had a patient treated by primary care doctors for a whole year. Constant high temperature. Instead of doing a simple ultrasound, they pumped her full of fever reducers, antibiotics, anti-inflammatories. By the time she got to me, kidney tumor at an advanced stage. A tumor constantly requires mobilization of resources, and the proteins fighting it sometimes raise body temperature. Or the tumor starts breaking down, and that causes fever too. So if you have chronic fever lasting 3 or 4 weeks, do a screening. Abdominal ultrasound, blood work, urinalysis. Blood in the urine. This can be from inflammation. Maybe you have an enlarged prostate. Maybe you ate beets. That happened to me once. I ate a ton of beets. Went to the bathroom in the morning, thought, what the heck? Then I remembered, but if you rule those things out, blood in urine is a bad sign. Not always cancer. Could be kidney disease, a non-cancer problem. But if it is cancer, it's likely kidney, ureteral, or bladder cancer. A characteristic sign, if it's bleeding from the kidney, the clots that come out are often worm-shaped. Blood came from above. If the entire urine sample is evenly colored, maybe it's a kidney issue, maybe a bladder tumor, maybe just cystitis. A good test is urine cytology. You're looking for abnormal cells, not just blood. Sometimes you can see blood with the naked eye. Other times there's blood you can't see. That's why regular testing is crucial. Urine can look clear, but actually contain red blood cells. Get regular checkups. Once a year or once every 2 or 3 years, get a full workup. If there's visible blood, the first thing we do is cystoscopy. We go in with a camera and look at the bladder. The intestines deserve special attention, given the high percentage of colon cancer cases. What are the signs? We all expect blood in the stool, but it's more complicated. Blood in stool isn't always cancer. Tons of conditions cause mucus and blood in stool. Ulcerative colitis, your colon covered in ulcers, can look very similar to cancer. Blood can appear with hemorrhoids. A characteristic sign with hemorrhoids is blood on toilet paper. You don't see it in the bowl or on the stool, just on the tissue. But still, see a proctologist. Sometimes the shape of your stool changes. It becomes very thin, pencil-like, ribbon-like. Some growth is narrowing the passage. If it becomes consistently thinner, always coming out as little pellets or pencil thin, that could be related to other problems. But it's reason to investigate. Regular constipation, regular bloating, signs of sluggish bowel obstruction. Maybe a tumor is compressing part of the intestine. Sometimes we see elderly women brought in with full bowel obstruction. Can't go to the bathroom at all, abdomen distended like a drum. And instead of having surgery 6 months earlier, we end up creating an ostomy and starting chemotherapy. At that point, we're often not even talking about recovery anymore. If you notice your stool has changed, if you notice constant bloating, get a gastroscopy and colonoscopy. It's a camera you swallow, a tube with a camera. Lets us look at your esophagus, stomach, duodenum. From the other end, after inflating you with air, we look at your large intestine and rectum. If there are growths, the doctor can often remove some right away. You go in, they see a polyp 2 or 3 millimeters, they cut it off and send it for testing. Sometimes these are benign polyps that still need removal, because over time they can turn into cancer. Or you test stool for occult blood and see red blood cells. Could just be colitis. By the way, sometimes it's the opposite. Regular diarrhea can also be a sign of a tumor. I really recommend getting a colonoscopy after age 35 to 40, even if you lead a super healthy lifestyle. After 35 to 40, at least once every 2 or 3 years, get a gastroscopy and colonoscopy. These procedures are must-haves. Another really good test is stool for occult blood. Often you can't see blood with the naked eye, but it's there. If you're scared of colonoscopy, at least do the stool test. It's better than nothing. Then there are signs that are really not good: coughing up blood and shortness of breath. Sometimes a growth appears in the bronchi causing you to cough up blood or feel short of breath. Get a chest x-ray, possibly a bronchoscopy, or send sputum for cytology. But coughing up blood is not normal. Now you could have the flu and some blood vessels burst. You cough up blood once or twice. Don't panic. Sometimes a person has food poisoning. They're vomiting. Blood vessels burst. You might see streaks of blood. Again, don't panic. All the rules I've laid out today apply when things are happening regularly. If you have constipation once, diarrhea once, don't give in to anxiety. When we were in medical school studying diseases, we'd find every single one in ourselves. The worst thing you can do is test for every tumor marker on your own, draw your own conclusions, and live in constant fear. My experience shows that people who are constantly afraid, always thinking about getting sick, unfortunately, end up coming to me more often. Maybe our thoughts shape our reality. Some people think they had a premonition. Actually, I think we attract what we constantly think and talk about. Think positively. Don't be afraid of cancer. We can treat 95% of cancers now if they're caught in time. Just keep these signs in mind. Remember that your health is in your hands. Usually people watch an episode like this and immediately want to close it, shut it off. Don't do that, because you might notice these signs not just in yourself, but in your grandmother, father, friend. We often overlook ourselves because we're scared. But if you see your friend suddenly losing weight, tell them, "Hey, I watched this video. Go get checked out." By watching these videos, you're not just helping yourself. You're helping everyone around you. Knowledge brings peace of mind, confidence, and enormous benefit to you and everyone in your life. Support our channel, subscribe, and wait for new episodes.